I know we're live, but am I blinking? I need to be blinking. Okay? I need to be blinking because I refuse. I'm your host, by the way, BKP. I refuse to let anything mess up the Christmas spirit. Now, we're live, Circuit World, running a little behind. You out there deserve a quick explanation. Let
me give it to him.
Okay, sure.
Something got in all these wires and stuff, and it didn't work. And then Josh couldn't make it work. And they were calling these people, and they were calling back, and they were talking about computer stuff, which I don't understand. And BKP went out to the car, and he got in his trunk, and he got a new old style, what do you call it? Yeah, well, yeah, the old school camera. And then he got around and he hooked up all these wires. I've thought all this time that he needed this infrastructure, and if push came to shove and it was the end of the world, he could do it by himself.
Well, thank you. That was a great explanation. Thank you. By the way, this would be Dr. Whaley. Thank you.
You're good. That's exactly what happened. I mean, you go tell him a bunch of technical stuff, right?
So, yeah, but I didn't get to do all, I was going to sing my opening like, it's a Merry Christmas, but I'm going to move right along.
No, go ahead.
Go right ahead. No, I've got, oh, by the way, our box, how many names we got there? Like 1,700? 1,700. 2 weeks ago, Circuit World's been blasting it out. We've been blasting it out. You have been sharing it. A couple weeks ago, we told you that you would have your choice of this 43-inch TV, which if I would win, I would take the TV myself personally, okay, or an Xbox. And that's going to happen at the end of the show.
What's an Xbox?
You play those video games.
Yeah, see, that's way past my technical. That's past your technical.
No. Well, that
actually you proved it was not past your technical. I'll
have to say this. What it really is it causes future thumb problems. So
carpal tunnel.
Yeah, right. Future thumb problems. Okay, I'm your host BKP. We're Circuit World. We're not going to absolutely not going to let a little delay mess up our Christmas spirit. Josh, we running okay? I know we're jumping around here. But we got it back. Rick is here. Dr. Whaley is here. Candace is here. Everybody, we got something special today because what I did is I called everybody. And I said, tomorrow, and I do not know any of the stories. I said, tomorrow I want you to share your favorite Christmas story with kid, family, whatever it may be. Just a Christmas story.
Experience. Personal experience. Okay. All right, you ready?
No. First of all, your tie.
Yeah.
You do know what that is. That's a bumble.
No, I have no idea.
Actually. Yeah, that's a bumble. Bumbles bounce.
What's a bumble?
That is...
It's a Christmas tie. I know that. Somebody gave it to me. Somebody gave it to me a couple of days ago, and I had no idea what it was, but I was wearing another tie. It says, that's not seasonal, so I put it on. There it is.
But I think it also says naughty.
Yeah, I'll bet it came from Rose's or Walmart or somewhere.
But let's not gloss over it says naughty.
It's not silk. Yeah, naughty but nice.
Oh, naughty but nice.
Yes,
got it.
Okay.
Dr. Whaley?
All right, I'm going to tell you, I have a lot of great Christmas memories. I can remember during World War II, my dad coming home, and I've got 4 children and 7 grandchildren, but I was thinking about kind of an unusual and semi-pleasant experience. It's December the 24th, Christmas Eve and Christmas Day of 1968. 1968, I was in Vietnam. I was on a ship called the USS Dale. We were 17 kilometers off the coast of Haiphong Harbor. What happened on that day, and about a week before, the Chinese had exploded I'm not supposed to do that. The week before, the Chinese has exploded a atomic bomb test, and there was a 24-hour stand down for Christmas to start at midnight on Christmas Eve and at midnight on Christmas Day. And this was just 3 weeks before Tet, so things were going crazy. And we're out there in the middle of the Tonkin Gulf, and Phyllis Diller is on a aircraft carrier, Bob Hope, and they were giving a Christmas show on television. So Phyllis Diller is going to come and come out to our ship and get lowered down on a wire like you see. And
what year is this?
1968.
All right.
December 24th, 1968.
Now, a lot of you out there don't know Phyllis Diller, but a lot of us here do.
Oh my gosh!
No, maybe not a lot. Not a lot.
Well, they know Bob Hope though.
Bob Hope, yeah.
And so anyway, Bob Hope and Phyllis Diller.
Now I know. Well, what I was saying is we know Phyllis Diller.
All right. So anyway, the weather is horrible, and we have a long story that we're not thinking that we can shut that thing off. That it's going to happen, and then all of a sudden, out of these big clouds, is CH-53, what's called the Big Mother helicopter, comes, and it's obviously not going to be able to lower anybody, and it makes a big circle of the ship there, and they've got a chief petty officer in the Navy wearing a Christmas beard, like in a little red hat, and you can see he's got a red jacket over his flight jacket, and he's got a big chain around him where he can stand out on the runners and wave and everything. And I'd be damned if there isn't little Phyllis Diller, what, she's 60-something years old at the time, couldn't weigh 100 pounds soaking wet, right? And they've got a harness on Phyllis Diller like you would see in old movies, and she is on a wire just like this guy, and she crawls out on the runner of that helicopter like that, and they come down to maybe 50 feet around, and she made a couple big circles of the ship there, and they were playing Christmas music out of that helicopter, and she was waving to everybody. You've never seen many more people excited in their life to see that little woman out there doing that. And then that night we had you can't have alcohol aboard ship, but we had baked Alaska, and they poured a few of the brandies you have when you pull somebody out of the water on it and lit it. So that was my kind of unusual Christmas memory, was Phyllis Diller.
1960, Phyllis Diller.
Yeah, 28 days later, the Tet Offensive started.
Now she did a lot of. Is it USO? Is that? Did I get that right?
Yeah.
She did a lot of USO.
Well, she did it every year. With,
yes.
Everybody thanks Bob Hope. Because
Right.
Bob Hope did it for 40 years. I mean,
Right.
he started in World War II. But she probably did 30 or 40 herself. And then Raquel Welch, and some of these people were really devoted to that thing.
1968.
1968. It's December 24th, 1967. 68 is
Right.
New Year's Day.
Right.
So
So it's 1967.
Yeah.
You're on the ship.
Yep.
December 24th, and Phyllis Diller.
Yeah, and the war's going on crazy. I mean, they're bombing and strafing and shooting and everything. Christmas Eve, all day Christmas Eve, midnight Christmas Eve, the stand down starts. So it's morning of Christmas morning when all this occurs, and then midnight on Christmas night, things all over with. They're bombing again. But there was a 24-hour period there where we didn't do anything except watch Phyllis Diller, and I think we watched that dance in that Christmas movie, and then we had our baked Alaska.
Well, I asked everybody, and I thank you very much for starting the day off. That is a great way to start the morning off. This is our Christmas program here. This is Ask the Doc from Georgia Cancer Specialist, affiliated with Northside Hospital. I don't have my computer out. I didn't have time, so I'm trying to do it from memory. But now I don't have questions.
Well, we got two questions, and I'm going to take the second one first because it's actually an important question. I know that it was asked with sincerity, and it bothers me a little bit that the person asked the question. So the second question says, as a young female, now, I don't know whether that means in her teens or it means in her 20s, but obviously young. I was diagnosed with cancer, and I am in remission and well for 5 years, and I recently married. So I think in late adolescence she may have had a malignancy. What are your recommendations for future pregnancy management for cancer survivors? Now that's a really good question. I've got all kinds of graphics that we didn't have a chance to get to, but basically, I don't know of a cancer center. I don't know how long back this goes, but I would say, she says 5 years she's been free. for at least the last 5 to 7 years, large cancer centers with every single new cancer patient is required to have fertility discussions before beginning treatment. And so literally yesterday I was starting a 73-year-old on treatment, and I said, I'm going to tell you that you have to use 2 forms of contraception if you're having sex with a female who can be of childbearing age. And the guy just laughed at me. But it's not really funny because were you at that? I know that Rick was at that cancer benefit over at Blue Jeans, where they pointed out that almost 20 years ago, I'd had a 17-year-old boy that was going to go undergo lymphoma treatment that had a high chance, not 100% chance, of making him sterile. And he didn't have any money, and when I got to a fertility clinic in Atlanta to freeze his sperm for him, and then the local Fannin County Cancer Support Group paid the yearly fee on it, and he's had 2 kids. So I mean, that's something that should have been done a long time ago. So I would say, one, you immediately need to go back to the cancer center, or come see me. I'll be happy to refer you. And then we have a whole fertility, sexuality, survivorship program that is around helping you figure out about parenting and the fertility issues. And so I've got tons of stuff here we could go into, but I'm not going to do it. In the interest of time and Christmas, how's that?
All right. I was trying to pay attention, but Candace has played a good trick on me. We won't call it a dirty trick because it's Christmas. But Candace knows I have trouble paying attention, and she gave me these lights and they're blinking. So I'm trying to pay attention, and I got lights blinking too. So we'll call it a good one because everything today is Christmas.
You're not going to have a seizure, are you?
No, but I'm trying to pay attention, and out of my, I'm blinking. I'm like,
flashing lights will give you a seizure.
No, the sad thing is that my memory is so short that I forgot I had something around my neck. I'm like, what's blinking?
Well,
that's me.
I got to joke
What's
about
blinking?
the short
Yeah,
memory.
that's
Okay,
me.
all right.
Go
Now,
ahead.
in the interest of time, the other one, the other question, and it's easy, but it's not. I've been sick for several days. I went to the doctor. I got a steroid shot and a cough liquid for nighttime. However, when I lay down, I cannot seem to stop coughing, even after taking the nighttime cough medicine prescribed. Is there anything else I can do to stop coughing at night so I can actually sleep? And the funny answer would be yes, tear pages off the calendar for the next 21 days, and it will probably get better. But I've got, once again, I've got many graphics we're not going to show. But first, all of the cough medicines, even the prescription cough medicines that contain hydrocodone, are not very effective in suppressing pathological cough when you've got real bad bronchiolitis or an infection and we're assuming this is infection. Those of us old enough to remember Phyllis Diller remember Paragoric that you used to sign out of the pharmacy, and cough medicines with codeine. Used to be like Robitussin AC, Robitussin with codeine. Well, the tree huggers got the codeine out of the over-the-counter drugs 30 years ago, and codeine is not an abusable drug, really. It's a great drug for diarrhea, and it's a great drug for cough. And codeine is not in any of the prescription drugs for cough. So some of our older doctors, for Dr. Bernstein, for example, who's 70 years old, recently retired, had a really bad cough here a few weeks ago. He says, "Hey doc, call me in some codeine plain for cough." Well, I did that, and twice in the last 2 weeks I've done it, and the pharmacies don't even have codeine in the pharmacy. They got to order it. Some poor guy's coughing and be there in 3 days. So anyway, nighttime cough medicine's not supposed to work. So here are the eight things that you can do in addition to take your medicine, except tincture of time. Stay hydrated.
Okay.
Cut plenty of fluids, because when you're sick, you're coughing away. Hot drinks, and I hate to say it, but those cough things with menthol and all in there sort of soothe the throat. They don't suppress the cough, but it makes that a little bit easier. Take a hot, steamy shower, get a humidifier, get irritants out of the air, because you know, if you got a puppy or a cat or something that you don't have any problem with, it might increase that during the period of time that you've got the cough. And then it says find out what's causing the cough, and we already know that they went to the doctor and they got some kind of infection. So that's enough of that. There's a bunch of other things, but that'll answer that question.
We want to thank Georgia Cancer Specialist affiliated with Northside Hospital for this segment. Now, this is our last one of the year. Next Friday, we will be at the Fandon Park and Rec with basketball. So I want to say to you from FetcherNews.com and Good Morning here from Circuit World, thank you very much. I enjoy every single Friday. I enjoy reading the questions and trying to pay attention to the answers.
Well, I enjoy it too.
I'm going to say this now. I want to say this very sincerely to you as a good friend. I always feel like I'm getting ready for a test.
Well, I'm getting ready for a test.
I always feel like I could actually maybe take the test. I'm always worried there'll be an essay question at the end. That was my weak point. But I can't say enough of how much I appreciate you, and we appreciate you, and we enjoy you being here every week. Now, I have a question.
Yeah.
And I'm going to tell you this. You have amazing stories. You just do. I mean, in my life, if I had to say 5 people, okay, and I just think out loud, if I had to say 5 people that I can just sit and listen to amazing stories, you're in the top 5 in my life.
Well, I appreciate
you.
That.
Now, you do know you have hockey sticks you owe me stories on, right?
Stories.
Okay, anyhow, just so you know. But I was able to see a picture of you, Chris Christopherson. Okay, can I tell this?
Yeah, go right ahead.
You, Chris Christopherson, Johnny Cash, Willie Nelson, and Waylon Jennings.
Yeah.
And I have a question.
Yes.
Have you met Merle Haggard?
Yeah.
I just wanted to make sure.
Yeah.
That's how you make it official, because if you're going to have Chris Christopherson, and you're going to have Johnny Cash, and you're going to have Waylon Jennings and Willie Nelson, you had to have Merle Haggard in there.
I've got Paycheck and
I saw
David Allen Crowe and
I was able to
Hank
see
Williams Jr.
and
Randy Travis,
but
and Gary Morris. You saw all those, and you saw Roy Rogers.
Yes, Roy Rogers.
You saw
right.
Crystal Gale.
Crystal Gale, yes, I did.
Yeah, okay.
Now, was in the one picture, is that Waylon's wife with him?
Yeah.
Yeah, that's Waylon. Is it Jesse?
Yeah, Jesse.
Yeah.
Jesse was a very good friend of Jane, who's on here with you most days, but not today. Well, Jesse was a good friend of Jane's.
Yeah.
I got some great pictures of them on the beach with big old hats on and everything.
Oh, we should show those on a Friday.
Yeah.
Yeah.
All right, well, we got to do the news thing because
we got to get to that. But I just wanted to say thank you.
You're welcome.
I appreciate it. Merry Christmas.
All right, listen, and I got back up on my soapbox, but I'm not standing up. This is going to be great. This came off the wire December the 20th. That's last night.
Yep.
Now, these are the top things in the news. I just want you to listen to number 1. 6 months of walking may boost the aging brain. The effect of walking is equivalent to shaving 9 years from brain age. Well, wait a minute, what we're talking about. All right, now, stress keeps 1 in 3 Americans up at night, and not enough sleep or stress is risk for obesity and decreased mental functioning, dementia, heart disease, and diabetes. And the way you get the more sleep is you go to bed earlier, but you also exercise. Then they tell you about avocado and a couple of food recalls. Then the next one says exercise may be as helpful as blood pressure medication in the treatment of high blood pressure. And then 1 in 4 people over 25 will be hit by a stroke, which you could diminish by 40% by regular exercise. So of the top 6 news items yesterday out of 300, 2 were on food recalls, and the other 4 are all about walk an hour a day, 5 days a week. I'm off my soapbox.
Okay, thank you for that.
You enjoyed that, right?
Yeah, I enjoyed
I mean,
that.
I got to plug
I
away.
enjoyed that. Now, Jane is headed down to the airport to pick up her
Yeah, got to
your
pick up her
mother-in-law,
mom, right? Yeah, on her way to get to the airport.
She's from Plano, Texas.
Plano, Texas. And she's 91 years old. Or
Yeah, you know what?
something?
I was setting up. I got to tell this. I was setting up one morning at Sycamore Crossing. I had never met your mother-in-law before. Okay. So I'm setting up at Sycamore Crossing. It's a couple years ago, and I'm rushing around, and she comes and she sits in a chair, and she's sitting there, and she said, "Well, I'm Jane's mother," and I said, "Well, it's great to meet you." And she said, "I'm from Plano, Texas," and I said, "I'm from Plano, Cherry Log." I wasn't even thinking about Plano. I said, "Where are you from?" She said, "Plano, Texas." I kept wrapping up. I said, "I'm from Plano, Cherry Log." So, Merry Christmas.
And don't they look alike?
Oh, gosh, yes.
Awful,
and she's a wonderful lady.
Yeah,
she is.
Yeah.
You and everybody have a Merry Christmas.
Well,
Thank you for that great story. 1967. Where are you going to get stories like this? And we got so many more. 1967, Phyllis Diller on the ship USO. Great. Thank you very much.
All right.
We're going to be back right after this with the All-Star Political Panel. Is Bruce gone on baby watch? So Bruce is not here, Jane's not here, but we're going to carry this puppy right through. We got it. Okay. Hey, 1,700 names. We'll talk about that in a minute. Take us a break, Josh.